So what do I need to perform this examination? Well, any standard emergency department bedside ultrasound machine will do well for this exam. We'll need to have the high-frequency linear array type probe. That's the probe that you're already using for vascular access, which we'll be using for ocular ultrasound. We'll need lots of gel or preferably Surgilube, as Surgilube is less irritating to the closed eyelid. Now let's watch a video on how to perform the ocular ultrasound examination. Here we have the high-frequency linear type array probe in our hand, and note we've prepared our patient with a copious amount of Surgilube on the outer part of the closed eyelid. We're going to gently place the probe over the patient's closed eyelid, scanning through the eye, and note that we're going to orient the probe both superior and inferior, looking all the way through the eye from the anterior aspect down through the posterior part. Now, from this orientation, I like to have the probe marker oriented laterally towards the outer part of the patient's face so that I know where the structures of the posterior part of the eye are oriented. Now let's take a look at that same ocular ultrasound approach from a more anterior position. Note again that we're placing the probe, the high-frequency linear type array probe, over the closed eyelid in a side-to-side orientation. Now the probe marker is going to be oriented laterally towards the outer part of the patient's face. Now remember that if there's any question of trauma or globe rupture, we have to be extremely careful when applying the probe onto the eyelid. In fact, we should really be scanning through a copious amount of gel, known as a gel pillow, and really not applying any pressure down to the actual eye. To complete our examination of the eye, we should also perform ocular ultrasound from the vertical approach, having the probe in an up and down configuration. Note here, we're again scanning through the closed eyelid. Now we have the probe marker up towards the patient's head. We want to scan from side to fully investigate the eye in a second plane for any signs of pathology. And here's just a closed-in view showing the probe placed over the closed eyelid. Here's a more anterior view, again showing the vertical approach to bedside ocular ultrasound. Note the high-frequency probe placed over the closed eyelid, and scanning from side to side will image all parts of the eye. Remember that the probe marker for this vertical approach is going to be oriented superiorly. And imaging in two planes will best round out the examination of the eyeball. Here's a typical ultrasound of a normal eye. This eye is taken in the horizontal or side-to-side probe configuration with the probe marker lateral. We see the cornea, the anterior-most structure of the eye, and we see below the cornea the rounded iris. Note the classic appearance of the lens just below the iris, which has a hyperechoic or bright appearance due to its very hard refractive pattern. And we can see little refraction waves coming off the back of the lens. Note the anterior chamber, that potential space, just anterior to the iris and below the cornea. We see the vitreous body and back of the lens, and note the retina, well seen here, to the posterior aspect of the vitreous body. This retina is well tacked down and in opposition to the posterior aspect of the eye. That's a normal examination. Now, if we have the probe in a side-to-side or transverse orientation across the eye with a probe marker lateral, and we aim the probe a little bit more inferiorly down towards the patient's foot, the optic nerve sheath will come into view. Note the optic nerve has a classic appearance on bedside ultrasound. It's dark or hypoechoic, and we can see it leading right up to the back of the eye.
Para la medición del diámetro de la vaina del nervio óptico, tomo como referencia la retina, me muevo 3 milímetros hacia adentro y es en ese punto en el que debo hacer la medición. Tanto en esta imagen como en el próximo vídeo, quiero que os fijéis en la estructura que corresponde al nervio óptico y aquella que corresponde a la vaina del nervio óptico, que es la que nosotras vamos a querer medir.
I've got my fingers resting on the bridge of her nose to try to avoid applying too much pressure to it. Okay, so what we have here is the vitreous chamber, right here. The lens and iris is up here. Down here you can see where the optic disc is actually bulging up into the vitreous chamber, consistent with papilledema. retina, 3 millimeters back.
Okay, so you start right at the retina,
Uh-huh.
and then go 3 millimeters back,
Mm-hmm.
and then that's when you're doing your transverse measurement then?
Yep, it's just going to be one single transverse measurement. Right.
Now
there.
where your A is right in there, is that really at the top of the papilledema, or is that, where exactly is this A?
Yeah, so this A is going to be on the retina, not actually on the top of the bulging disc.
Oh, good. I'm
Yeah.
glad I asked that.
Yeah, so you're going to go 3 millimeters from the retina, or where the retina would be, right? You can follow that all the way around where the retina would be. This is just bulging disc right here.
Mm-hmm.
3 millimeters back because previous studies have shown that's where the best clarity is to actually measure the optic nerve sheath diameter.